I'm just gonna do the camera properly. Hello. 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 Okay, zero. Hello. Hello. Okay. I think we're fine now. Just move this back a bit and we are good to go. Let me check if, just to confirm if we're live, then we have to kickstart today live session. We're starting by 8 p.m. We are good to go. Let me check if, just to confirm if we're okay. I think we're live now. Hello, everyone. Let's just wait for a few people to come online, then we will start today's um topic, because this is more or less like one of the most asked questions under my video, and I have decided to come online today to talk about it. Hello, everyone. If you're watching, just drop on the comment section and let me know where you're watching from. My name is Messi Mary, and I am a registered nurse and midwife in Nigeria, but I'm currently practicing in the UK as a registered nurse, working in the theater. So, on today's video, we are going to be talking about what affects the sperm quality. So that's what we're going to be talking about today. So I'm just going to wait a few more minutes just to make sure that we are at least okay online. If you're watching, just let me know where you're watching from. Just leave a comment on the comment section. Let me know where you're watching from, please. Hello, hello, hello. Let me know where you're watching from. So I'm just going to go straight into the live section of today of what we are going to be talking about, and that is what affects the sperm quality. So this is actually a very important topic that we usually overlook. We see it's not a very important topic, but generally this is something we have to look into, what actually affects the sperm count of a man, because when the sperm count of a man is affected, fertility is also affected. When there's an issue with the sperm count of a man, fertility is affected. So if you are watching this live, kindly let me know on the comment section. Drop your name and let me know where you are watching from as we discuss this important topic. So this video is for everybody out there, especially those that are trying to conceive, not even those that are trying to conceive alone, those that are trying to conceive, if you are planning to conceive in the future, and also if you want to understand your body generally as a man, this particular video is for you. So most times when we hear about fertility, what comes to our mind is usually the female. We feel the woman is responsible for infertility. We feel the woman is to be blamed for infertility because she houses the womb, she houses the sperm. But fertility is more than just the woman. It has to be both the woman and the man inclusive. So when you're talking about fertility, you're talking about the man, you're talking about the quality of his sperm. And you're also talking about the woman, you're talking about the quality of the body to receive that sperm and make that sperm a baby. Okay, so male fertility contributes to over 40% of the infertility cases today. It's not even like women contribute 80% and male contributes 20%. No. Male fertility contributes about 40% of the infertility today. I have seen a lot of couples who have been battling with infertility issues, but with a little lifestyle modifications, that was sorted out. Yeah. With a little lifestyle modifications, that was sorted out. So sometimes that infertility you keep hearing about, something is causing it that you need to just adjust. That may not necessarily need those medications, that may not necessarily need those big treatments. It just needs you to do some certain things that involves your lifestyle, and everything is going to be fine. Okay? Please and please, if you are watching, just let me know where you are watching from and kindly drop on the comment section. Okay? Just let me know where you are watching from. I'm waiting for some comments in the comment section before I dive into the topic proper. I'm just using this style to wait for people to come online. If you're watching, kindly drop a message on the comment section. Let me know where you're watching from. Okay, it's up. If you're watching and you are my follower, kindly drop a comment in the comment section and let me know where you are watching from. So while we are waiting, I would like to ask a question. If anybody has an answer to this question, let the person let me know. And that question is, when you hear sperm quality, what comes to your mind? When you hear the quality of sperm, what comes to your mind? When you hear somebody saying, there's something wrong with my sperm count, what comes to your mind? When you are going from semen analysis, you're going for sperm count analysis or semen analysis generally, what comes to your mind? I really want to know what comes to your mind. So while we are waiting, I would like to ask the question. If anybody has an answer to this question, there's something wrong with my sperm count. What comes to your mind? When Okay, I'm just going to dive straight now. When we talk about sperm quality, when people hear about sperm quality, the first thing that comes to their mind is the sperm count. Yes, that is the first thing that comes to most people's mind. But when semen analysis is being done, it is more than just the sperm count. It is more than just the sperm count. So when you go for a laboratory, like when you go to a lab, when they refer you to a lab to get your sperm analyzed, most people say, "Oh, I went to check my sperm count, and my sperm count is okay." But you didn't really give them your sperm alone. Actually, you gave them your semen, and inside that semen, you have some percentage. Inside it, that's where you have sperm. So that fluid that you gave them for analysis is not just sperm that is inside. It has a sperm and other fluid in it. And also, when it comes to the quality of sperm, we are not just talking about the sperm count alone. We're also talking about the shape. Does the sperm you are producing as a man has the right size, that's the normal shape, or it's having an abnormal shape? That's something that we also take into consideration. And the other thing is the movement. Are the sperm moving faster? Are they moving very slow? That is also something they usually look at. Then the other thing is the count. Then the other is the volume. So they're going to be taking note of the volume of your sperm count, the amount of your sperm count, that's the count, and also the shape. They're going to be taking a look of the shape and how fast they are. Are they very fast or are they very slow? These are the things they usually take into consideration when you go for semen analysis. But a lot of things can affect your sperm count, and that one of it is your lifestyle. We're going to be talking about the lifestyle factors that affect the sperm. The lifestyle factors that affect the sperm. And one of it is diet and nutrition. What do you eat? What you eat, what you take in affects your fertility in general. It's not just the woman, the man, that's what I'm talking about now. So, what you eat affects your fertility, both as a man and as a woman. So, if you eat more of this processed food, more of this canned food, it is not ideal. So, if you are trying to conceive, it is advisable you stay away from processed food and take in more of green leafy vegetables. And also, if you are a man trying to conceive and you're having a lot of sugary substances, a lot of soda, a lot of sugar, it is not ideal. So, sugar, processed, canned food can affect your fertility as a man. Here I have that sugary drinks lower sperm count and increase DNA damage. You know, all those sperm you have, they have to do some DNA, year of DNA test anyway. So these things can affect the DNA damage. So if you are a man that is planning to conceive, or you're having issues with fertility, trying to conceive, or you are planning to conceive in the future, or you are planning to conceive now, it's advisable for you to reduce your sugary food intake. It's advisable for you to reduce those processed food, those canned food that you keep taking. It's advisable for you to reduce it. It's advisable for you to take more of leafy greens, eggs, fish, whole grains, rather than this processed food. So I've seen a man who switched from all this processed food to green leafy vegetable, and that impacted on the sperm count, and that has a great impact on the sperm count. So please and please, if you are trying to conceive, I'm advising you, and I'm repeating it over again, your lifestyle when it comes to diet and nutrition affects your sperm count. And I would advise you to work on that. Stay away from processed food, stay away from sugary products, just to help with your sperm count and your sperm health. Then the other that affect your sperm count that's going to help is physical activity. Yes, simple exercises just as swimming, running, walking are generally good. They help with hormone balance and blood flow to the testicles. And you know, when there's an increased blood flow to your genital area, that is generally good for your sperm health. But you should take note that too much exercise is not also good. Too much exercise is not also good when it comes to the quality of your sperm. So for all those that are building muscles, that are taking these steroids, steroids have an impact on the sperm count. So if your man is trying to build muscles and your man is taking all those steroids, that can be affecting the man's sperm without him knowing. So it is advisable for him, or for him, not her, it's advisable for him to stop the steroids while trying to conceive, because steroids can affect the sperm count. Steroids can affect the sperm count. If you have any question, kindly drop on the comment section and I will be willing to answer all of them for you. Then another thing that affects the sperm count is alcohol, smoking, and drugs. Alcohol, smoking, and drugs. So tobacco generally reduces the sperm count and makes them slower. So if you are smoking tobacco, its audio is static. What do you mean when you say audio is static, please? Just going to do this. I would like to know what you mean when you say the audio is static. Can you hear me? First of all, can you hear me? If you can hear, just drop on the comment section and let me know you are hearing me. So we can move ahead. If you can hear me, just drop on the comment section. Let me know you can hear me. Hello? Oh, so sorry. You said it sound good. I tried to stop the sound as well. Okay, I'll just continue with this. Okay, if you can hear me now, we'll just go ahead with it. So another thing, like I will always say, that affects fertility is alcohol, smoking, and drugs. Alcohol, smoking, and drugs. These actually have impact on the sperm quality. It has impact on the sperm in general. So if you are trying to conceive as a man, it is advisable for you to stay away from smoking. It's advisable for you to stay away from alcohol and all those recreational drugs. Yes. Smoking actually reduces sperm count and makes them slower. Weed, cocaine, and excessive alcohol disrupt hormones. That's something you should take into consideration. These actually disrupt the hormones. So generally, I know a particular person who wanted to stop, who was trying to conceive and got aware that smoking generally affects fertility. He had to do away with alcohol and smoking, and the sperm count actually goes up. After, like, I think after 6 months, he went to check again, and the sperm count was quite better than it was. There was improvement when it comes to the quality of sperm and also the quantity of sperm. So while trying to conceive, still look at this factor: reduce your alcohol consumption, reduce your smoking, reduce that intake of recreational drugs, because they don't only affect the sperm morphology, they may affect how fast the sperm is. They can also affect the DNA. They can alter the DNA of the sperm. So personally, I would advise you to reduce smoking. I will also advise you to reduce that alcohol intake. I would advise you to reduce or stop the use of those recreational drugs. So that's that. Then environmental and hazard. Environmental and occupational hazard. This has a role to play too when it comes to the sperm count. So your job, what do you do? What chemicals are you exposed to? What toxins are you all exposed to? So these toxins, these chemicals that you are exposed to at work can affect the sperm quality, can affect your sperm count. And for those that are doing this, what they call it now, I've forgotten the right word to use. For those that sit for too long, you sit for a very long period of time, you use your laptop, like your laptop is always on your leg, or for those drivers, those big truck drivers that sit for a very long time, they're exposed to heat, that can have impact on the testicles, and that can also affect the sperm count. So if you're trying to conceive, take a look at your work. Find out what you are exposed to. Is it likely going to cause impact on your sperm or not? So that gives you a clue if it's to change, have a job swap, or like they should take you to another location in your company just to make sure that you boost your sperm and also prepare yourself for having a child. So that's that. Then another is health and medical condition. Health and medical condition. So if you can hear me, just drop on the comment section. If you can hear me, just drop on the comment section. Oh, Stepford said can't hear you. This is serious. If you can hear me, just drop on the comment section, please. I really need to know if you can hear me. This is serious. So I don't end up talking to myself. Let me check on my other phone. Can you hear me now? Can you hear me now so that I can continue? Anyway, let's continue. I believe some of us can hear us, can hear me. If you cannot hear me, I don't really know what to do right now. So health and medical condition can affect fertility. Health and medical conditions can affect fertility. So STI, chlamydia, untreated UTIs can scar reproductive organs. STI like chlamydia, untreated UTI can scar reproductive organs. And also women that have a PID, pelvic inflammatory disease for the women, can actually cause infertility. But for men now, this STI, chlamydia, can scar the reproductive organ, making it difficult for them to conceive too. So that's something you should take note of. And if you're having chronic conditions like diabetes affects the nerves. It also affects blood flow. I don't know, like, where should I be looking? Should I look here? The more I look here, I think. Okay, I should look. I think I'm looking at the camera like this. I'm looking at the camera like this. So chronic conditions like diabetes actually affect fertility. So if you are diabetic, it's very important for you to speak with your doctor, especially when trying to conceive and you are finding it difficult to conceive. So there's also a condition known as varicocele, which is the enlargement of the scrotum, enlargement of the veins in the scrotum. Yeah, when the veins of the scrotum are enlarged, that raises the temperature and damage the sperm. So varicocele can affect the sperm because of the increase and raised temperature of that body. So that's something you should also take note of. In case you notice anything, any signs of varicocele, and you are trying varicocele. I keep calling it varicocele. If you notice any signs of varicocele and you are trying to conceive, I will advise you speak with your doctor. All right. Then some medications such as chemotherapy medications. Like I was saying, medications such as chemotherapy medications, antidepressants, and steroids can affect production. So it's advisable, if you are on any drugs, generally advised, if you are on any medications and you're trying to conceive, let your doctor be aware, let them know about it. That is going to go a long way to help. Then this other one is age and sperm quality. We all know that as a man age, as a man grow, the sperm quality tends to reduce. You get? Yes, we know of men that can father kids at old age, But generally, as a man go, fertility tends to decline in that man. So that's something you should also try to take note of. So generally, if as a man you got married late and you are trying to conceive during the first month, it's not working, I will also advise you quickly see a fertility specialist to actually give you good advice during that period. And if other source of conception can be taken into consideration after trying, do that as soon as possible. So your emotional and mental health. Can you hear me? If you are hearing me, kindly drop on the comment section. Let me know you are hearing me. I've listed a lot of causes. A lot, is it a causes? No. I've listed a lot of things that affect the sperm quality. So if you've not watched it from the beginning, I will advise you to watch the video after I am done with the live. So the other one is emotional and mental health. Stress raises cortisol, which blocks testosterone production. Yes, that's what you don't know that. So if you're always stressed out, there's going to be a release of a hormone called cortisol. And this cortisol can block the testosterone production. And when that is blocked, that can also affect your sperm quality, your sperm count, and everything you need to know about your sperm. So, anxiety, depression can reduce libido and might cause hormonal imbalance. So, if you're anxious, you are being depressed, that can also affect your sperm quality. So that is why I advise couples when trying to conceive. Sometimes I know it's easier said than done. Sometimes it's much more better for you to focus on bonding and having sexual intercourse. I don't know if you get. It's better for you to just focus on bonding, focus on being together, focus on enjoying yourself, focus on like be happy, focus on the happiness at every given situation as much as you can. Because the more stressed you are, the more anxious you are, the more depressed you are, the more likely for you to increase your chances of infertility too. So the best thing is to try as much as possible to stay on the positive side of life. Try as much as possible to avoid things that are going to stress you out. Because remember what I said, when you are stressed out, there's going to be an increased release of cortisol. And this cortisol is going to decrease the production of testosterone. Sorry, let me check. I think somebody is up.